This patient was referred to me for the extraction of her lower right wisdom tooth. She had suffered from multiple bouts of pericoronitis and wanted to have the tooth extracted. Looking at the OPG, we can see the roots of the lower right 8 are separate from the superior border of the ID canal. The bone appears to be of soft to moderate density. This is in keeping with the age of the patient, who was in her late teens, and there was distal chronic infection behind the tooth, which sometimes makes it easier to remove the tooth through elevation.
So we are going to give an ID block to anaesthetize this lower right 8. When giving an ID block, what we're hoping to do is to palpate the external oblique ridge, which is here. If you follow up the buccal shelf, you can then feel it going across just over here. And we're aiming to deposit our local anaesthetic in the pterygomandibular raphe. Technique, I use an indirect technique. I'm aiming to palpating the bone, going halfway between the top and bottom teeth, pinch, hitting bone almost immediately, and I'm swinging round and inserting. About 2/3 of the way in and depositing my local. And deposit the rest on the way out for the lingual nerve. This is a long buccal block. We're doing a little bit on the 8. So we're aiming to hit bone. Distal last standing tooth. Pinch. Fine. I'm going to deposit some local just over the operculum. And to raise the papilla just over here. Well done. Excellent. Well done. External oblique ridge. I'm going to feel where the bone is and make sure my incision's on bone. Generally, as a rule, I'll go 45 degrees to distal buccal cusp of where the tooth is going to be. And that way we're safe from touching the nerve. So it will be on bone all the way down. And then we can release the papilla between the 7 and the 8 as well. Done that, we can then score the incision to the back end of the mold, number 9. Go across the crest, so lots of pressure, go across the crest, go across the buccal of the 8. And we can lift the operculum and see where the tooth is sitting, just on the tooth here. Gently just reflect apically. So into this pouch that we've created, we can pop the Minnesota retractor into the space. So we know there's conical roots. I'm going to start off with size 3 luxator mid-buccal, apical pressure, forcing it down the long axis. Lots of pressure now. Try and upright it. Pushing against the buccal bone. Very, very gently lever it out. tissue. Take this out on the roots. I'm going to pick up the incision, and in one sweep we take a bite of the tissues, take a bite halfway through, and then get hold of the end and curve it through. And we then want to tie our knot. My method to tie a knot is to do one throw over the top, get hold of the end of the thread, and I'll lock it and lift up. Once you lift up, it can then form a knot and then guide this down to where I want it to go. And then 2 throws back, 1, 2, get hold of the end, form my knot, and guide it down. 1 throw forwards, and guide that down. Second suture, I'm going to pick up the distal papilla of the 7, curve it through. And then remount it, pointing lingually, get the lingual tissues out of the way, and take a bite at the same spot on the lingual side. Get hold of the end, and curve that through. The entire knot. So 1 throw over the top, take hold of the end, lift and form a knot. Hold the right hand under tension with the left hand guide down the knot to where you want it to go. 2 throws back, 1, 2, take hold of the end, lift up, guide that where you want it to go. 1 throw forwards, and we're there. So a bit of suction there please in a moment. Good, that's fine. Excellent, very well done.